that I put up here, right? Don't you remember? We just talked about that. You just told me that. You told me that same story a week ago. It may sound minuscule when you say it, but think about it from the person dealing with the memory problem. What's their response? Shame. They feel a sense of shame. Why can't I remember? I'm frustrating my loved one. Why can't I remember that? Why can't I do that? So we've got to stop for that moment and think about that. And that's in the heat of the moment, when things arise and things aren't going the best during the day, that's your most difficult time.
Jason, you don't argue with them.
Yes, ma'am. That's a great point.
No, you do not. You accept it.
Well, that's my point with the next one. You know, the diseased brain is really good at trying to fill in the gaps. The problem is it's filling in the gaps with other things. They don't remember half of the story, so to the brain, what makes sense for the rest of the story? And that, it may be something they saw on TV. It may be something that they remember from years ago that has absolutely nothing to do with that current situation. But I will tell you, to that person, and it's no different dealing with people who have acute mental problems where they're going through an altered mental state. In their brain, it is 100% true. It is 100% fact. And I don't care how much you argue with them, that is not going to change. It's not going to change their mind. Because that's what happened in their brain. I had a boss man he was famous for one quote. He always said, that person's perception is their reality. And in a dementia situation, that may have absolutely nothing to do with reality, but it's their reality. Be supportive. There are going to be times where this person is going to have anxiety, have depression. They are going to deal with that, and the best thing you can be is supportive to that person. Just sometimes being there is what it takes. Oh, perseverance. You ever been stuck with a song in your brain? And the only thing that either cures it is your brain gets on something else, or you hear the song. At least that is for me. If I could just hear the song, that's better. But for a dementia person, it is very common for them to get in a rewind loop. It is the same thing over and over and over. We need to go to the bank. 5 minutes later, we need to go to the bank. 10 minutes later, we need to go to the bank. Tomorrow, we need to go to the bank. Right? And one of the best things you can do to help them is to redirect their attention. And every person's a little bit different. For some, it's a physical activity. For some, it's playing a game. For some, it's telling a joke. For others, it may be listening to music. It may be a fun activity. You just have to figure out what works for that person, because we all are a little bit different. The next one is another toughie, right? They're sitting there. They cannot come up with the word. They can't say what they're wanting to say, but you know what they're trying to say. And we are wanting to be very helpful. You're talking about, are you meaning? Give them some time. Give them a moment. Take the pressure off. Reassure them. It's okay. Take a moment and think about it. But avoid that temptation of trying to complete the sentence for them. The other last one there is remember that for dementia, they still remember events from long ago. So you can talk about things from the past. There may be clarity about events that they didn't even realize that they remember. But as short-term memory fails, long-term memory are more vivid. So childhood memories, young adult memories, talk about those. That's a great way just to engage and be there with that person. So let's talk about crises, because no matter how good we are, the wheels are going to fall off at some point. Something's going to change. Something is going to knock them off their feet, so to speak. So one of the things that all dementia patients struggle with, as I mentioned earlier, is being consistent with their medications. So it's imperative that family members, caregivers help set up medications, help monitor that they're taking their medications, and especially if they are on a medicine to help their memory. Because even short breaks from that memory medication, say 3 to 5 days, can result in huge losses of function. And remember, none of these medicines are curative, right? They're just stemming the tide of memory loss. So this will become one of those stair-step times if they have to miss their medication for a prolonged period of time. Watch for signs and symptoms of infection. This is something that there's a lot of different reasons for this, and I think every female that is over the age of probably 50 already knows this. The signs of bladder infections as you get older are less and less and less, but the problem is worse and worse and worse. And for a dementia patient, they have even less understanding of what's going on with their body. They may simply complain of, my stomach hurts. And what you got to start thinking about is caring for that 18-month-old, not the 81-year-old. And take it seriously. Get it evaluated. Don't wait. Don't wait. Consistency is also one of those big things. And when we're talking about consistency, we're talking about daily activities. We're talking about where we live. We're talking about our environment. And the more consistent they can keep their environment, the less of a problem they have. They are not going to deal well with schedule changes. You can't come up that day and switch it up on them. It is not going to work. They are going to have problems with that. And we all know things happen, and sometimes you can't avoid it. But try and avoid and try and be as consistent as possible. And a regular sleep schedule is terribly important. And it's one of the most challenging because it does not take much for a person with a brain disorder to go from a normal sleep pattern to an abnormal sleep pattern. We all have heard, the adage of, oh, that baby just has their days and nights mixed up. These people really get their days and nights mixed up. And part of that is because as the sun goes down and the brain is getting tired, the less the brain can hold on to time. What time is it? And then social activities kind of play into that same sort of realm. And that is, if you're planning a gathering, if you're planning a social activity for that person, don't count on them early in the morning because it takes longer to get ready. It takes them longer to get their brain in gear, to eat their breakfast, to get cleaned up, to just do normal stuff. Planning too early is going to set you up for frustration. Planning too late, they are going to be dealing with a tired brain, and they are not going to be very social. They may become a little agitated, but you will also notice that their ability just to interact in general is so much less. They can't get words out, they can't remember dates, times, events, and most of the time what's going to end up happening is that person is just going to withdraw further and further from that activity. So, plan ahead, right? Boy Scout motto, be prepared. Because for every person that suffers with any form of dementia, there is a progression to the disease. And that person is going to require more and more care the longer it goes. So plan early, talk often. I can't stress it enough. Plan early. It is not too early to talk about things like, what is it that you want when you can no longer, and finish the statement, right? What is it that you want when you can no longer cook for yourself? Or you can't dress for yourself, or you can't operate a telephone, or you can't, there's so many things. At some point, that person is going to need someone there at night, usually first, and then during the day, and then it's 24/7, and one person cannot do it all. This is truly one of those situations where it takes a... So, we'll talk about a couple of these things, but I've got some resources at the end of the slide. There are 3 companies in Salisbury and more in Mooresville and some in Statesville that actually provide in-home sitting services. If you're VA connected, military personnel actually have even more access to in-home services. But you have to ask for it. It's not something that they're just going to tell you about. There's a form you fill out that you qualify for. But in-home services, such as a sitter, somebody just to be there, somebody just to come in and give a bath or fix a meal, is not home health care. Many of you guys know my wife, Angie, and she was a home health nurse for a while. And this was probably one of the biggest misunderstandings that they had in talking to families about home health services. Home health is not a sitter. They don't come in and do baths and meals. They come in and provide health care. And at the most, you're going to get a few weeks of services once or twice a week. But that's it. So the rest of it starts to become more of it's on the family, it's on friends, acquaintances, it's on services that you pay for, whether you're going to hire your own personal sitter or you're going to hire one of the companies that provide sitters for folks.
So are you saying the in-home sitter does not do the bathing and the meal prep?
No, an in-home sitter can, depending on the level of service that that particular company provides. If you hire your own, you can hire someone with the understanding that that's what you want them to do. What I'm saying is home health care, like home health nursing, doesn't do that.
Okay. But long-term care insurance might cover it, even though your Medicare would.
That's correct.
The VA service, what does that, do you know what that involves?
So there's a form, and I can't remember the number on the form, the ID number on the form, but basically, depending on whether you are the spouse of a veteran who was VA connected, and depending on the level of services, so the VA has different levels, you may qualify to be able to apply for those in-home services through the VA. And then, of course, there's moving out of your own home into the home of someone else, or going on into a nursing home. So we want to support independence as much as we can, because we want that person to continue to have the dignity of an independent life and to be able to do their own thing. But there are limits to that. And one of the biggest things that we need to be doing is providing safe space for that. And so making sure that we are supervising independent activities of daily living. And these are things like using the telephone, cooking, bathing is an activity of daily living. But even doing your checkbook or using a credit card, right? So there are multiple things that we need to consider. Durable medical equipment. What are the things that that person needs to live in a safe place? Is it a wheelchair? Is it a walker? Is it a toilet seat? There are those things that are available. Medicare pays for 80%, but it has to be doctor ordered. But you got to start thinking, what are those safety devices that we need to have around so that we avoid falls and injury, which can actually make the dementia worse because the person ends up with a broken bone and lands in the hospital. We're going to come back to wireless monitoring, but we talked a little bit about medication planners, right? So the medication, either the weekly, the monthly, or daily planners, so that it's easy to just open that up and take that medicine at the right time. That's okay in the patient dealing with mild dementia, but as they progress to moderate and severe, my mother-in-law, I talked about my father-in-law a little bit last time, but my mother-in-law actually did this, and it made a big difference for Danny, is she put up a whiteboard and put it on the refrigerator, and every day she wrote down the events for the day. And then underneath she said tomorrow, and she wrote down tomorrow's. Next morning she gets up, she moves tomorrow to today, and writes it again. It just helps them keep a consistent area where they can go to see what's the plan for today. And it actually helped to reduce some of her frustration of Danny constantly asking her, so what are we doing today? What are we doing tomorrow?
I have 5 of those.
So wireless monitoring really has changed the face of dementia and dementia care, and actually has made it easier for families to stay connected to their loved one. You know, we all make fun of the commercial I've fallen and I can't get up, right? The life alert system. Well, that was one of the first wireless monitoring systems that came into existence. And it simply connected to a telephone call center, so someone would call 911, or it would notify 911, someone would come out and check on the person that had pushed the button. Well, today, there is innumerable technologies that are now available to you. From wireless home cameras that you can put in the house to quickly tell where that person is, to smartwatches, including the newest Apple Watch, and also Garmin makes one now that detects falls. So the watch actually will notify the family member that the person has fallen. Now the key is they got to be wearing the watch, right? If they're not wearing the watch, it doesn't do the job. So these are all sorts of things now that are available to us that weren't available even 10 years ago to help in caring for that person. Even putting an alarm on the door to know when they're going outside. Very important. Okay. Toughest discussions that you will have as a family, as a community, dealing with people with dementia are going to be around safety issues. Because human beings and Americans in general are terribly independent individuals. We don't want to be told what to do. We don't want to be told when we can go or where we can go. We don't want to be told that we can't have that $5. Right? So I have lost patience over these discussions. I've lost patience. I met with them. We had talked about their memory issues. All the signs were towards progression. And it came time to have the driving discussion. Now, I put a lot more up there, right? But let's focus on the driving discussion. And I want this to be a little more interactive. When do you think is the right time for that person to stop driving?
When they can get back home.
What does that mean?
Remember how the roads to get back home.
When they get lost.
When they can't remember which side of the road to be on, or when to, stopping at red lights, safety issues, because they do forget those.
I think when they start having trouble with their vision and stuff, my husband has trouble with his left eye, he can't see out of it.
So there are more physical issues, such as vision, that play a role, but
When they can no longer anticipate to be a defensive drive.
Larry forgot how to turn the car on. He told me one day, he said, I don't remember how to turn this car on.
so there's no hard and fast rule on this. There's no wrong answer to what you all have said. Because absolutely, the first sign of their inability to safely operate that vehicle, not being able to remember directions, right? We've been there 1,000 times. Now, which way do I go? I can't remember where we're going. Why are we going this way? From a safety standpoint, that tells you that person is dealing with significant, and there's a key word, significant brain dysfunction. Significant because you pull up to a stop sign and you look right, and you look left, and you look right again. Or you look left, right, left. What happens when you forget that there was a car coming? It's not then just about that person, it's about the other person. It's about the other person. So the way I approach it personally with patients is basically to say, are we seeing significant brain dysfunction that would indicate that their higher level of ability to operate such a powerful piece of equipment is affected? And if that answer is yes, they should not be on the road.
Are you saying that you tell your patients individually, if you have a patient coming to you and you see that they're starting to show signs, you tell them that they're getting dementia? You tell them up front that they're starting to lose?
So that goes back to our original discussion last month, and how do we diagnose it? So Linda, in those situations, I'm going to evaluate that person for the presence of dementia. What's the problem? Try to get at the root. See if there is another issue. But yes, I've made that diagnosis in those.
And you tell them?
I tell them early on.
So that they can be aware that it's
Here is where we are. This is a progressive problem. And at some point in time, we are going to have to talk about a lot of this stuff that's right up here. Should you be operating a stove or an oven if you can't remember to turn it off? Should you be operating a stove if you leave the room and forget that you had it on? And there's a pot on to boil and you melt the pot. Should you be living by yourself if you can't remember how to brush your teeth? Or to properly store food, or to heat it up, or have a method to heat it up? These are safety issues. Safety issues. But they are some of the most difficult discussions to have, not as a physician, but to have with a loved one who has dementia. Because their first response is going to be, it's not that bad. You're making mountains out of molehills. It was just one time. We all forget. But it's difficult. One of the biggest things that I think is unfortunate about our electronic world that we live in today are the number of scammers that take advantage of not only the elderly, but especially those with memory issues. It's existed for a long time. I won't go into details, but my own family dealt with this with my mom's parents. They were conned, honestly, out of everything in their checkbook by a family member. But they still had access to the checkbook to write checks at a time when it was not appropriate for them to have that access. They lacked the ability to know exactly what they were doing. The other big thing that I didn't put up here is around house fires. How many of you have gone through a house fire? It's traumatizing, isn't it, Lisa? It is, oh my goodness, this is the worst thing ever. No matter how small, how big, it's traumatizing. And your ability to respond in that emergency situation, your brain has to be on point. I need to get out of the house. I need to call 911. I need to make sure the kids are safe, the dogs are safe, whatever it might be, right? For a person with dementia, that alarm going off, they may not even realize what it is. But it sends them into a tailspin. And they end up being harmed because they're the only one there. Before we get into the last couple of slides, there are a couple of other things that I mentioned that we would talk about. And one is around eating and maintaining healthy weight. And I didn't put this up there, but as we age, there's a couple of things that happen to our bodies, right? We get the gray hair. We grow hair where we didn't intend to have hair, right? We slow down, joints get stiff and sore, muscles get weaker. We lose teeth. But there's a couple of other things that start to happen. One of the things is our ability to smell and taste changes. So the same foods that we loved years ago may taste different today. And all of it starts to become somewhat blunted. So we don't smell things as strongly as we But in a dementia patient, it is much more pronounced. You had. Do you remember the food? Remember what it tasted like? What if it just all tasted like nothing? It just tasted like you were chewing on cardboard.
Why is it like that?
It is just like that. The taste sensation and the smell sensations become blunted for dementia patients. And we know this because new technology allows us to look at the stimulation centers of the brain while people do certain activities. And we can see a huge difference in the olfactory and taste centers of the brain, where we smell and we taste. And so we know those signals aren't as strong. So the challenge becomes finding foods that they enjoy to eat. And I will tell you straight up, it's going to be something sugary or something salty. It could be something bitter, but mostly it's going to be sugary or salty, and it's got to be loaded. And the reason is because of that problem there. So sometimes we have to balance diabetes and heart failure and high blood pressure with, I just got to keep weight on. And it can be challenging. And none of these companies that make any of these protein shakes have figured this out yet, by the way. One of the things that I encourage folks to do early on is to start talking about end-of-life care. My wife and I have already laid out everything to one another. Being in the healthcare world, I have seen way more than I've ever intended to see when it comes to stuff like this. I have seen 90-plus-year-olds get their chest just beat to death going through cardiac resuscitation. It's sad, because even the 5%, 2% that survive with multiple rib fractures, and then they live in a nursing home. So my wife already knows. If I don't make it, I don't make it. That's it. You can shock me. You can try and bring me back. But that's it. Don't want much else. I don't want to go through that. But that's my personal choice. Everybody's a little bit different. And the one thing I would say is, have that conversation with all of your loved ones, not just those with dementia. Tell them what your wishes are. It is one of the best gifts you can give one another to say, if it comes down to it, and I can't make decisions for myself, and they want to keep me alive with a tube, don't you dare. I've had patients say, you do everything possible. I don't care what it takes. And that's okay. That's their decision. But there's a limit. I think we all have that limit that we're willing to go through. Have those conversations.
It's yours.
Awful. Awful. But in addition to things like end-of-life planning, healthcare power of attorney, financial power of attorney, estate planning, this is the topic for our last event in March. But the bottom line is plan early as soon as that diagnosis is made for a dementia person. Because if you don't, it makes for a lot of family heartache. We are some of the worst people to one another's in families. We really are when it comes to this. There's a lot of wrangling that goes on, and it's just better to have those discussions when that person can help make those decisions that affect them. I'll say real quick about palliative care and hospice care. So they are different things. If you don't know the difference, talk to me after and I'll give you a little bit of a primer on it. But in general, palliative care is about making people comfortable. It's realizing that there's no cure, but there are still things we can do. And then hospice care is palliative care, but it's in those last months. And yes, we want it to be months. We don't want it to be days. But it's in the last months of life. And for most dementia patients, it's when they reach 40% of their original functional ability. And there are forms, as a physician, I have to fill out to state this sort of stuff. This is nothing you guys would know anything about. But if that person is getting to that point where they've got 24/7 care, they've reached that functional capacity, and you need to be talking about palliative and hospice care at that point. Partly because it changes the focus and actually lessens the burden for the family and the caregivers.
At what point did you determine a baseline to determine deterioration?
Usually it's just going back to what were they like when they were working.
It's subjective.
It's very subjective. But it does involve things like their ability to cook for themselves, eat, use utensils, go to the bathroom without assistance, bathing, those sort of things. So it's a full functional assessment of this is the baseline. They can do all these things. Now they're here. And no discussion around caring for a dementia patient would be complete without talking about the caregiver, right? Caregiver burnout is real, and it happens quickly. Quickly. And remember, self-care is not selfish care. I will tell you, I have this discussion a lot more with women than I do men, and I call it the mom syndrome. Everybody else before me. And one of the problems with that thought process is what happens when mom goes down. Who's then caring for the kids? Right? 15 minutes is what I charge people with. I say, every morning, the first thought that you should have when you're caring for somebody with dementia or a chronic health condition that requires a lot of assistance is look in the mirror and ask yourself a simple question. What do I need to do for me today? Start your day with that thought. What do I need to do for me today? Because if you don't keep you healthy, there's nobody there to care for that loved one. And one of the best ways we can keep ourselves healthy is our own mental well-being, right? So it may be taking 15 minutes to read a book or to watch a favorite program. It may be 15 minutes to go outside and just smell the air. It may be that today I have got to go get the groceries, right? And that can be me time, because that can be time away from that person that you are caring for. And that's where other things come into play, like counseling, getting involved in a support group, so that you have a community. That's something we can do as a church, as a community. How can we help those families that have loved ones with dementia? Because believe it or not, that 1 hour a month might be the best gift they've received all year long. That 1 hour a month. Connect with others to provide short-term care, and that's what I'm talking about. I'm not just talking about those sitter organizations, but connecting with other folks, connecting with your social network, asking for assistance. And I know that is not in our Lutheran nature for those that go to this church, and probably not in our human nature for most of us. But there are a lot of times a lot more people willing to help if we just ask. Just ask. And one of the things that is available that most people don't realize are that most facilities will provide a 1 week of respite care for loved ones if you wanted to go on vacation. They will admit them for that week. They will take care of them. They will feed them. They'll take care of their medications, all of that for a week. And that can be life-saving for some caregivers. The 3 companies in Salisbury, I put telephone numbers up here. There are also websites for them. One is called Always Caring. They are located in the marketplace next to Food Lion, behind Peak Eye Care Center. Home Instead is located off of Jake Alexander in Salisbury. And then Comfort Keepers is actually located off of Clumac Road. What we all think of Clumac Road. But it's where some of those office buildings are. They're located in there. Typically speaking, they require 3 hours. If they're going to send somebody out, they're going to say it's a minimum of 3 hours. They do all the hiring and firing. They do all the background checks. If you have issues, you have somebody with the organization that you work with for those individuals that they send out. But they are excellent. I can wholeheartedly recommend all 3 of them. They are excellent. There's another company in Mooresville called Interim. Home Instead's also in Statesville. I've worked with them before. And Always Caring is partnered with Advanced Home Care through something called Adoration Health. It's a much larger umbrella that they're under. So you will find Always Caring in multiple locations across the United States. Yes, ma'am.
My mom just started getting in-home care, but the name of the company is Rihanna, something like that.
Bayada?
Bayana or something like that.
Beata's a
So
whole-
it's just two, this is the second week.
Yeah.
The Comfort Keepers is one of them, but that's the one that comes out now.
Yeah, Beata is a home health agency, but they have another arm, which is in-home services. And like last time, we'll post these slides. I'll get these to Pastor Scott this week, and we'll post them on the website. So if folks need them, they can go to our church website and download the slides. We put them in PDF format so that you don't have to have PowerPoint to be able to look at them. You can print them off. Makes them a little bit easier to view.
I work for the VA hospital, and I don't know if it, I was listening to the lady ask about the form. If you go to the patient advocate, it's in the building 3 on the first floor. They can help you with anything you need to know about anything. Home care, health care, I don't care, disabilities, whatever. It's called patient advocate. And that's Victor Dwayler. She's the manager.
So like last time, I'm going to open it up for discussion.
I'm interested in hearing more about the hearing aid you're talking about.
So they are called HP New Hera. N-O-H-P, as in Hewlett Packard. N-O-U-H-E-A-R-A. They're Bluetooth enabled, high-tech hearing aids. So they basically work just like the $8,000 models. But it's a company that basically their whole idea is designed around producing these at lower cost to make hearing more affordable.
Are these carried by stores or just online? Or?
They're online right now. They're online. I will tell you that Novant is actually talking with the company about making them available through our purchasing program. So if you go to novanthealth.org, there's actually patient services where you can purchase different things through Novant if you can't find it other places. And we hope to eventually have them on our website as well. We don't make any money off of it from a Novant Health standpoint. It's just patient marketplace where we will link you with vendors that we support because of things like this. They're not out to make huge amounts of money off of these things. They just want to make hearing affordable for everyone.
Are they covered by Medicare?
No,
Nor insurance?
not yet.
Didn't you say you did a prescription to, did you not? Oh, I was
Not for
thinking-
those.
Not for those.
Not for those. Now, I would encourage anybody who's thinking about getting hearing aids to go visit, not Beltone, but go visit a true audiologist and get your hearing tested to make sure that you're getting the right diagnosis before you purchase hearing aids. Because there are some conditions that are treatable, and there are some conditions that hearing aids won't help. So before you spend $800 on a set of hearing aids, please, please, please get an appointment, have a full audiology evaluation with an audiologist, with a licensed audiologist.
Then how can you determine that they are for you? How would you know?
Most of the companies that deal in online purchases like this actually have a trial period, and I think theirs is 30 days. There's a 30-day free trial.
Could you put that last screen up just to get the information? That's okay. That's okay.
I don't know why I switched. But I'll stick around for a little bit if anybody has any questions or anything else you want to talk about. Yes, ma'am.
You're talking about medications and not remembering. The lady I sit with, she doesn't remember days or times. They've got a dish, it looks like a dish out, and it's battery operated, but it goes off, hers goes off like twice a day, and this, don't dispense the pills, but you dump it, and the pills come out. It's the best thing in the world, because she wanted to double take and
Yeah. Those, I had a patient use that for pain medicine because they were overtaking the pain medicine, and their loved ones purchased it. They cost about $120, but it's an automatic pill dispenser, and depending on the number of times per day that you take the medicine, it may be a week, it could be a month, depending on that you have to reload it. And most of them,
2 weeks, but twice a day.
yeah, and some of them you can set to only allow the window to be open for 10 minutes or something. So there's different settings on those.
I hadn't seen it, but it's the best thing.
Yeah.
Thank you very much.
Them hearing aids, they're supposed to enhance hearing now instead of amplification.
Correct. They're not simple amplifiers, which are the old these are the simple hearing aids. Think of it like takes out background and helps. The amplifier is roar and whistle.
Okay, thank you very much. Appreciate it.
His neighbors called me and says he called us over here last night to get my child. He called me the next morning and said, "We need your help. We can't get it out of there." I got another 2 weeks later. And he's the one, the word got out, it was me. He had pneumonia, COVID, and everybody heard it was me. I'm the one that got over there. And they come asking me because and the son. Now, they